Cervical and lumbar nerve pain is I'd say, fairly common. It occurs probably in about 80% of the population at one time or another in their life. It most commonly affects adults. Okay, it is probably a slight predilection to males in comparison to females, and more common in patients who are overweight or patients who abuse their back, patients who are football players, construction workers, those sorts of things. Patients typically complain of pain along the back that radiates into the buttock, thigh, leg, or foot, or into the shoulder, arm, or forearm. When a patient has pain that radiates into those areas, it's most commonly a nerve compression or a disc herniation. It can be differentiated from acute lumbar strain, which is usually pain that's localized to the back, and that usually is self-limiting or goes away on its own with rest and anti-inflammatory drugs. If a patient has a problem like this, they really ought to see their primary care physician almost within the first few days, if it lasts longer than a few days. If it goes on for more than a week or 10 days, or if it's persistent, or if there's actually a neurologic deficit, which means they have what's called a foot drop, or they can't, when they walk, their foot drags, or they trip on their toe, or they have difficulty going up the stairs, leading with the affected extremity going up the stairs, difficulty holding onto their coffee cup. Those are indications that they have a neurologic deficit and they have a more severe problem, and that they need to be more aggressively treated. We always like to start with conservative therapy, okay? And number one, it's because it's best for the patient, okay? As long as there's not severe rapid progression of the disease, or as long as there's no significant neurologic deficits, we do rest, anti-inflammatory drugs, and physical therapy. And usually that can be done by the primary care physician. If the pain is ongoing, though, we treat this with steroid injection. There's a lot of special things about the way Shawnee Mission treats pain. We are the only pain clinic that I know of in the area that has a full-time pain psychologist. Pain is a very, very difficult thing psychologically, particularly if it's ongoing and if it's chronic. It affects a person's ability to work. It affects their family life, and it very, very frequently can go along concomitantly with depression, or exacerbate depression, or be a primary cause of depression. We also have excellent surgical staff here, and an excellent referral source for surgeons. They're all very good, both orthopedic and neurosurgeons, and I would feel comfortable sending my family to any one of the surgeons on staff here. I'm Dr. Dan Mitchell. I'm one of the pain management physicians here at Shawnee Mission Medical Center.